The title of this is Mental Health Considerations for the Coach. And I'm presenting this today not as a psychologist or a sports psychologist, but as a health educator and a coach here. And I think these issues are so important for a coach to understand. I think it's been very overlooked. The research shows that it's been very overlooked concerning sports. So let's talk about exercise psychology and sports psychology first, because I'm sure that's what a lot of people maybe thought we were going to talk about. So exercise psychology is concerned with how sport and exercise participation affect psychological development, health, and well-being. Sports psychology is concerned with how psychological factors affect performance, and particularly high performance. So things like competition anxiety are important. This is so important in many sports, and we need to deal with that. And oftentimes we have sports psychologists. They're helpful and with athletes that have issues with competition anxiety and dealing with that. Focus. That's also a very important issue in sport. However, oftentimes we don't think about the basic things and just go back to basics. This is Abraham Maslow's hierarchy of needs. And you see, according to Maslow, I mean, before we have, things like self-esteem, confidence, achievement, that we need basics like food and water and sleep and, security. So basic things are important. Now, what I guess motivated me or prompted me to talk about this was a presentation a few weeks ago by Dr. James Andes, if I pronounce that right, who talked about player welfare, a medical perspective. And in his talk, he mentioned mental health. And he mentioned that it was mostly overlooked in sports, that the key is on athletic performance, just like we talked about sports psychology and improving performance, and particularly high performance. And he talked about encouraging interaction with mental health specialists, and that's what coaches and athletes should do. And a key is early recognition and management of high-risk individuals. Well, in his presentation, he talked about a couple inventories that I was not familiar with, and so I started to look into those. And it talked about how important it is again, an early recognition and being able to manage individuals who are at high risk. One thing notice here, and we'll talk about it later, is monitoring. And it's so important to monitor your athletes in many different areas there. So let's get a definition. It's sort of long here, but I think it's important. This is a definition by the World Health Organization. Mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It is an integral component of health and well-being that underpins our individual and collective abilities to make decisions, build relationships, and shape the world we live in. Mental health is a basic human right, and it is crucial to personal, community, and socioeconomic development. Mental health is more than the absence of mental disorders. It exists on a complex continuum, which is experienced differently from one person to the next, with varying degrees of difficulty and distress, and potentially very different social and clinical outcomes. Mental health conditions include mental disorders and psychosocial disabilities, as well as other mental states associated with significant distress, impairment in functioning, or risk of self-harm. People with mental health conditions are more likely to experience lower levels of mental well-being, but this is not always or necessarily the case. Now, we assume, I believe, that sports participation is always healthy, both physically and mentally. We talk about how it can do so many things to help out, it can build their self-esteem. They become more confident, physically healthy. But this is not always the case. There's a study that was done with high school boys in Jamaica and Barbados that found, and I quote here, contrary to a number of empirical findings, we found increased levels of sports participation to be a significant predictor of delinquency. And we always just assume if someone participates in sports, the situation is going to cause them to improve both physically and mentally, but that's not always the case. That depends coach and the culture and what goes on in the gym there. So what we need to do is we need to create a good atmosphere, and we'll talk about that in a little bit. I looked at this consensus statement regarding mental health with athletes, and this comes from the article where it states that mental illness affects up to 1 in 3 elite athletes every year. The elite sports culture, with its heavy training demands and constant drive to improve performance, only serve to heighten the risks, the evidence suggests. So there is a problem that again is often overlooked. And again, the assumption is this doesn't occur with athletes, and we think even and particularly with elite athletes, just sort of brush it to the side often. The statement goes on to say that coaches and sports governing bodies have a crucial role in helping to destigmatize mental ill health and promote a culture of mental well-being, say the researchers. So we've got this stigmatism with mental health, not just in sports, but oftentimes wants to mental illness, but no one wants to say, I feel like I have some mental health. We'll talk about physical health issues. We have no problem, and hey, I got to go to the doctor, and we take care of things. But oftentimes, if it comes to mental health, we just brush it aside, and oftentimes it's because of that stigmatism that's in society that something's wrong with this person. We're not as worried oftentimes being around somebody that's physically ill as we are around somebody that may have mental issues. So we need to change that. This is where the tools are. And I know John will put these PowerPoints up, and I've made this interactive here. Let's see if it works here, where we can look at some of these articles. Okay, can everybody see that? John, can you see that? Did it come up there? Anybody?
I can only see the link.
You can always see the link. Okay, the articles aren't going to come up. Anyway, it is available online. You can Google it. It's the IOC Sport Mental Health Assessment Tool. It has actually 2 tools in there that has one is more for practitioners, for psychologists, and the other being more for the coach, the athlete, the parents, the entourage with the athletes there. Okay, so let's see if I can exit this without exiting everything. Okay. All right, so the IOC Sport Mental Health Assessment Tool, SMHAT1, And again, this is the inventory that was talked about 2 weeks ago here, is a standardized assessment tool aiming to identify at an early stage elite athletes defined as professional, Olympic, Paralympic, and collegiate level 16 and older, potentially at risk for or already experiencing mental health symptoms and disorders in order to facilitate timely referral of those in need of adequate support and or treatment. And so this, I don't think you can see this, and I don't think you can see if I go to it. This is the SMHAT1, which is available online through IOC. This is more for doctors and professionals in mental health there. Just in general, some mental health professionals. I looked around for something internationally. This is what I found. In the US, it may apply differently throughout the world. But I think in general, the psychiatrist is a physician. They go to medical school. They get an MD, a doctor of medicine, or a doctor of osteopathic medicine, a DO, and their specialty becomes mental health. They can prescribe medication. Okay. I actually worked for a psychiatrist for 4 years and did exercises therapy with psychiatric patients. A psychologist is someone that generally holds a doctoral degree, such as a PhD or a PsyD. Okay. And they work in a variety of mental health conditions there. Oftentimes they work as a team with the psychiatrist. There's also psychiatric mental health nurses, physician's assistants who oftentimes specialize in mental health, licensed clinical social workers. Counselors are generally differ from psychologists. They generally have a master's degree. But they make sure that they're licensed. Check things out with mental health workers. Should you seek help from one, to make sure that they are certified and licensed and not just proclaiming to be. Okay. The other tool is that can be used by athletes, coaches, family members, and as we mentioned, all the other members of the athlete's entourage, is to recognize mental health problems, not to diagnose them. You're not going to diagnose or treat. That's up to the professional. So this inventory presents a list of athlete experiences, thoughts, feelings, behaviors, physical changes that can be indicative of mental health problems. So actually, this is hard to see, so I put it here because this is the one that you would use as coaches. So here's some common experiences of mental health problems, thoughts, and a lot of times these things may occur, but it's only when they get excessive and occur constantly that they become a real problem. So thoughts: excessive self-criticism, low self-esteem, pessimism, hopelessness, problems with focus, concentration, and memory. If we talk about overtraining, oftentimes some of these things occur. And we know that with overtraining of athletes that oftentimes there's mental issues as well, psychological issues that can occur with overtraining. And if you're really monitoring your athletes and monitoring their fatigue, hopefully you won't reach this condition. But oftentimes, just again, as I mentioned, we assume that a sports setting We're going to have good mental and physical health, but not always. If we're overtraining the athletes, we may end up with both physical and mental problems there. So be looking for things like that. Notice your athletes. Are they having problems with focus, concentration, and memory? Do they come in the gym irritable, angry, mood swings, sadness, extreme disappointment, depression, loneliness, emptiness, just a lack of passion for anything, training, lack of motivation? The profile of mood states test is something that's used to detect overtraining, which looks at all these as well, and often is part of the monitoring process by different used by different coaches to look for things like this. Actions, aggression, withdrawal from others, not going outside as much, being more quiet than usual, unexpected drop in performance, sports, school, work, any of these. So just be aware, be observant of your athletes. Physical changes, low energy, poor sleep, changes in appetite, changes in weight and appearance, physical signs of harm by self or others, including cuts and bruises, evidence of alcohol or other substance abuse, tremors, bloodshot eyes, change in pupil size, a characteristic smell of marijuana or alcohol, slowed or poor coordination, injuries or arrest after using. So just be observant again. And again, I talk about the overtraining, but some of those things could cause low energy, poor sleep, and changes in appetite and weight and appearance. So, good coaches need to monitor their athletes, be aware of what they're doing. So you need to be constantly looking for all these signs here. Some of the red flags, these are the real serious things that are in this tool here. They talk about if you observe any of the following, seek immediate help. Comments related to harming self or others, talking about feeling hopeless or so overwhelmed that you cannot function, dramatic weight changes, other highly uncharacteristic behaviors, emotions, and appearances, an episode of overwhelming sudden onset of fear with marked physical symptoms such as sweating or shortness of breath that has never before been experienced or is different from prior episodes. Like this could be a panic attack or another medical problem as well. But if you observe any of these, seek immediate help. You should know ahead of time, who you would go to. If you have a sports psychologist that works with the team, they could, if they may be certified and qualified to deal with some of these. If not, make sure that they know or somebody in the medical profession, a psychiatrist that you could refer these athletes to, or a psychologist, somebody who is trained and who could help the athlete. There's also an IOC mental health toolkit, and this is available online. You could, I'll have the links here when you get this PowerPoint. If you're looking for that before that, you can always email me, or I'm listed there in WhatsApp. You can use my WhatsApp. I'll send you the links directly. You could Google IOC mental health and you can find some of these tools. There's actually a really nice toolkit. It's in several languages there as well. So that'd be something that I would advise everybody to go take a look at that and all these other tools. A lot of stuff, it's up on IOC Athlete 365, which is a good site. There's a lot of good educational materials that I'd recommend that you check that out, okay? So this is the toolkit here. So, what else can we do? As with good health, it says here preventative measures. The best thing to do is create a good atmosphere um, that's positive in the gym or on the track or wherever we're working with our athletes. Okay. You know, uh, this positive atmosphere can prevent, negative situations from arising. This is from an article that I co-authored with Guy Hornsby and Mike Stone talking about weightlifting for children and adolescents. And I'll quote from that article. It says, just as beginners and particularly children could be taught poor lifting technique, and this could apply to any sport. Kids that are taught poor techniques in any sport and movement habits that are difficult to alter. We know that if we teach skills wrong, they're hard to change later on. But it's also they can develop negative psychosocial behavior resulting from poor coaching methods and a bad atmosphere in the training at the training site, in the gym or on the track or wherever. And we need to stop, this if we have that going on, this negative environment. We need a positive environment amongst our athletes that we coach. And as it says here, whether physiological or psychological, both are difficult to correct. So just create a situation that these things don't happen in the first place. Again, this deals with weightlifting, but can apply to other sports. It's important to develop correct technique and initiate the development of a sound physiological basis and positive psychological habits from the first day of training. First day, that you work with an athlete, have that positive atmosphere. Be positive with the people you train. I always talk about how sometimes kids get up in the morning and their parents are on them about something. They go to school and the teacher's on them. They get all negative comments all day. And sometimes it's nice when they come to the gym and the coach can say one nice thing. If they're practicing a skill and they're doing things wrong and one thing right, point out that one thing right. I always try to leave a positive comment at the end of the day when kids leave the gym. Tell them something positive, make them want to come back there. Let it be a place where they're going to get of course they need mistakes corrected, but you should also reinforce the things that they're doing right and keep it positive. They'll want to come back. So, as well as even with sports psychology, talk a little bit about that. We oftentimes, things like that I mentioned about focus, oftentimes we think, oh, we'll get focused at the competition because you're going to really be focused there because that's what really counts. No, you need to practice focus, and you need to focus on every lift. I talk about with weightlifting with our kids. I ask the kids, what's the most important lift in the training that day? And they'll say, oh, the heaviest, snatch or the heaviest clean and jerk. And I'll say, no, it's the lift you're doing at the moment. You need to focus on each and every lift with each and every drill that you do, every step, every movement. There needs to be focus. If you put it into practice and training, it's going to be a whole lot easier in competition to become focused. Another important thing to develop is and I'm saying this over and over again in different ways, but we need that positive environment and the development of a good sport culture. I mentioned something about Olympism. When I think about all these positive things, if we, what's it about? And many of us are coaching Olympic sports. And we know that if we look back to the history and we look at Read about Olympism. Olympism is blending sport with culture and education. It says Olympism seeks to create a way of life based on the joy of effort, the educational value of good example, and respect for universal fundamental ethical principles. Again, I think sometimes we become so focused on high performance and just, we oftentimes forget why are we doing what we're doing. I'm not putting down high performance. That's, we want our athletes to perform well, but we need to consider other things as well. The Olympic values, excellence, friendship, respect are the foundations upon which the Olympic movement brings together sport, culture, and education for the betterment of human beings. Excellence. Of course, we want that high performance. We want that, to give one's best on the field of play or in life. So it's not only about winning, but also about participating, making progress against personal goals. And those are so important to emphasize, striving to be and do our best in our daily lives. It's good to keep good records, keep those personal records. Good coaches should sit down and go over goals, do goal setting with their athletes, and keep good records on from training. Those can help. I mentioned when I worked with the patients for the psychiatrists, we kept records there with their training, and that motivated them. They built their self-confidence up, got them motivated. Looking back at some of those records, sometimes we don't think we're making progress. And if we look back at those good records, we can see that we are making progress. We can also use those records to evaluate the training and make changes to improve it in the next cycles there. Friendship, to build a peaceful and better world thanks to sport through solidarity, team spirit, joy, and optimism. To consider sport as a tool for mutual understanding among individuals and people from all over the world, despite the differences. So remember these things. Remember these things when you're training your athletes. I had a good experience related to this. This is a couple athletes that I coached. This is back at the 1998 Junior Olympics, where in the U.S. at Virginia Beach, Justin Bellamy and Kendrick Ferris, and then Kendrick went on and became an Olympian in 2008 in Beijing, and he and Justin were good friends, and Justin made his way there to Beijing to see his friend and his teammate. Respect, to respect oneself, one's body, to respect others as well as rules and regulations, to respect the environment. In relation to sport, respect stands for fair play and for the fight against doping or any other unethical behavior. So, what should the coach do? According to the Sport Mental Health Recognition Tool, number one, allow the athlete to tell their story. Listen to the athletes. Talk to them. Listen to what they have to say. Be non-judgmental if they have any problems, and understanding. It gives an example here. I'm sorry you're feeling this way. I'm glad you told me about it. Don't condemn them for any problems they have. Again, as I mentioned before, know which resources are available, encourage help seeking. Just like with physical problems, we need to have a plan. We need to know what to do if somebody gets hurt. What do we do in an emergency? And we need to know the same for any kind of mental health issues as well. Remember to look after yourself when assisting an athlete with mental health challenges. Consider what adjustments in your coaching approach might be needed to help the athlete's mental health while maintaining or creating a positive environment. Again, recognize the need for positive feedback, encouragement, and the right balance of challenge versus support. Consult with a medical team if you have one. If not, seek some sort of medical assistance. Discuss the possibilities of adjustment in the training. Even with high performance, we always think that we need to do more, and sometimes we oftentimes need to do less. Remember, it's quality and not always quantity. Okay. Always consult with your technical staff if you have one. Some other considerations to make corrections if somebody's doing something wrong. Don't forget to reinforce the things the athletes are doing right in training. Keep it positive. And if you keep that, all the athletes will hopefully be positive among each other, and it'll just be a great atmosphere for training. Be observant, and encourage athletes to get support needed as early as possible using these tools. It's so important to note that the coach is not responsible for diagnosing or treating mental disorders, but just be aware of symptoms associated with and refer athletes to the appropriate professionals. Always keep good records. We need to monitor its athletes, not only to prevent bad situations, to monitor mental health, physical health, improving their performance in their sport. All right. Any questions?
Yes, I have one.
Okay.
So how were you able to deal with the mental block when it comes to a high-performing athlete?
It depends on the mental block and what it may be. In an ideal situation, if it's something like that, we'd have some sort of source of a sports psychologist who's a specialist in that. I know sometimes the coach has to do everything. Sometimes the coach has to deal with psychological issues. They have to deal with some simple injuries and things like that. But I think oftentimes there's probably more help out there than we think. We just have to seek and look for it. But mental blocks would be, what kind of mental block would you be talking about there?
In this instance, they're unable to get themselves in the zone.
Like in competition or in training?
In competition.
What things did you work on anything in training that might help?
Not in particular.
Sometimes athletes, we think even high performance athletes may have some issues with their confidence. And I know I can relate best. I can relate some to athletics, but mostly with weightlifting. And one thing I think that helps get athletes in the zone is that they're confident when they get up on that competition platform to make their lifts. And one thing we start from an early age when they're young and in competition, that coaches can pick the lifts, how much weight they're lifting. And oftentimes they get 3 attempts in the snatch and 3 attempts in the clean and jerk. And we try to do what we can to start light enough that they make all their lifts. And they may not do the heaviest they could have done that day, but they've made all their lifts. And with each competition, we increase gradually. And if they're making all their lifts in competition, they believe they can make all their lifts later on, and they have that confidence. That's one thing that we do to build the confidence with weightlifters. Also, we make sure that they're physically prepared and that they understand the training program and they're feeling good, and they know if they've had a good training cycle, they're confident that they're going to do the very best they can. those are some simple things that I use and have used with athletes to build that confidence up for the competition, which to me, that sort of confidence is so big, and that sort of helps prepare the athletes for a good competition.
Thank
Anybody
you.
else have
Hi,
any
Doc.
comments on that?
Hi, Doc. Alex.
Hey, Alex, how you doing?
All good, Doc.
I missed you in
I
Cuba.
think, no. Financial issues. I want to follow up on my colleague's comment on the mental block. I have a similar situation with my elite athlete. He once got an elbow dislocation and he was treated. But that thing is stuck in his mind. I tried all the psychological help I can, but still a problem. So from what my colleague has been asking, it's a similar situation. If you find that, if I give an example of the Qatari Meso, who is surrounded by a team of psychologists, physiotherapists, and a medical doctor, you find that in our teams, we don't have such kind of support. We periodically do them based on the recommendation of the NOCs. But with weightlifting, you find that this is something that we have to keep on doing, especially when we have those kind of athletes who can perform, but they are now having that mental block. So I think it's a problem to us, especially when it comes to Africans. We tend to look at it that such that we don't necessarily need it in weightlifting, because weightlifting is normally a small team of athletes. So that is where the problem that we are having. So you end up as a coach being also a psychologist, and even if you ask for help, sometimes you don't know whether you are making right or wrong. Thank you.
Thank you, Alex. It's difficult. A lot of times it depends on your situation and what kind of resources you have. Sometimes if you have universities in your area, they can be a good source. Not always, but I think sometimes we need to get out and look around and ask some questions, check with other sports, see what resources they have. I'm not saying you're always going to find something, but I think it's I think that you should, um, search, see what kind of support might be available. There might be people that want to help and don't know that there's a sports team in their area that they could help with. Do you have a question, Harrison?
I have a comment.
Okay.
Yeah, so I have some experience with the national team, the women's basketball national team. I was there as the athletic trainer, and there's a time most of the female players would come to me and we just have conversation. And then I asked them, why did you come to me with this kind of talk and you have female chaperones and female team manager? And all I got was some shrugs like, uh, you know, it left a lot of questions in my mind because I was not officially there, but I still listened to them just the way you have advised us in your presentation.
Yeah.
And it really is not just about performances that even at the national team level, they carry a lot of baggages and they just need at some point to have that space for conversation outside of instruction, constant instruction about results.
Yeah.
Then for psychosocial awareness, I actually had program with the USIU, United States International University. There's the peer counseling club, where we went to one of my projects in Kayole because we had conflicts between the parents and the kids. They were in our development program, and they are now getting more aspirational and ambitious about going to universities. And where we work is an informal settlement. So the parents were getting aggressive about the program, that their kids are making so much demands. So we had to seek that intervention, and we brought the parents on board. Then the university came in with the psychology club and the counseling club and ran a 6-month psychosocial awareness training for the parents. Then they just blended in with the community. Then lastly, I think it's important that we advocate so strongly to have a performance team at the highest level of programming. This is even for our colleagues in other countries like Alex. Even if we find one, because at the Olympic level, we see this kind of investment where we have psychologists, sports psychologists coming in. So if the Olympic Committee can champion, even just through advocacy, to have coaches who are selected to the national team be briefed about things that happen to players or what players go through outside of the playing environment, then they'll be more sensitive and more considerate in their approach to working with the athletes. Yeah, instead of just going all out about the results and the championship. Yeah. That's my contribution.
Oh, thank you very much. That's so important. Yes, the athletes are often under so much pressure already, and sometimes that's increased. So yeah, anything to to sort of help with that. And it's nice that you had that open ear, because sometimes that's what people are looking for, somebody that'll listen to them and talk about things other than just their performance, and just talk about life in general, just take a break from things. It's so important, associated, I guess, if we talk about recovery and restoration from sport. I mean, we need to mentally unwind from sport as well, and recover not only physically but mentally as well. Thank you so much for those comments.
And thanks, Harrison, because the comment that he's making, that the team were coming to him instead of going to the team manager, the female team manager. It's about trust and having confidence in that particular person they talk to. If we have a psychologist who probably is not really trained in sports, sometimes is not really helpful. And sometimes, even like he's saying about the NOC championing these things, it is difficult when we have people who don't understand where you are coming from. Because sometimes the people just get to positions based on their own interest of boosting their own CVs. But I like what Harrison is saying, because this is what is happening to almost all of us. Because now sometimes the athletes trust you better than the person who's supposed to be doing that specific job. Thank you, Doc.
Thank you, Alex.
Kyle, maybe I could add that I don't know. We have a sports safeguarding policy that is really a vibe currently, especially after the scandals around women's sports, being sexual harassment, sexual exploitation of women. So I don't know the depth at which these safeguarding policies are being implemented and effected, in various sports. I don't know. Maybe we'll be advised with the current Olympics coming up, the depth at which this will be implemented, because it covers most of the elements that really take care of the mental health and wellness of athletes, because it really protects the athletes and advises the coaches on how to even just coach you know, from the tone of voice that you use with the players, you know.
Yeah, safeguarding is it's coming up. Even here in our country, we have one lady who's working with the IOC and the ANOCA. She's the one championing safeguarding. She's the president of netball. So we, even us in the NSAs, we have requested her to resource us in that regard. It's a new thing. I think it's coming up well, even though it's slow.
Yeah, that's so important. And if you don't have any information on that, I'll be glad to get that for you. Just again, contact me there through WhatsApp, or John has my contact information if you can't find it on our a group chat site there. But I'll be glad to provide that information. I know as a coach in the U.S., we have to do safe sport training every year, which is good.
So
Yeah,
Kyle,
John is listening. Thank you.
yeah, may I put in a comment, one or two, in regards to safeguarding? It's something that as a National Olympic Committee, I'm talking as part of the National Olympic Committee. It's something that we are aware of. There are trainings ongoing, and I believe that a few athletes have been selected to undergo those trainings. Currently, about 4 have been trained, but more have also been asked to join the program from September this year. In terms of empowering coaches and the personnel around the athletes, mostly the psychologists and the nutritionists, and just name all of them. There's a program that has been started in Kenya at the moment. We've realized that coaches need more, coaches and athletes need more support personnel, you know, around them that can help them, you know, achieve their goals and objectives in sport. So Nairobi University is putting up a curriculum that will be shared, coaches will enlist, and we'll go through most of these things we are talking about here. As a country, I think we've taken the right step, you know, just to empower our coaches, empower everyone around the athletes, you know, the support personnel. And we will be inviting more and more of presenters from the various, you know, various segments of various professions, just to come and share with us whatever little knowledge or skills that they have that can help us, you know, better our skills as coaches and being around athletes. Otherwise, thank you, Kyle, for giving me that opportunity, you know, to say
Thank you,
something
John.
on that. Yeah. So, any more concerns for Dr. Kyle? Harrison, Harrison,
So,
have you ever
yes,
attended any of these NOC, you know, organized education forums, coaches, you know, administrators?
interestingly, I've been trained from Uganda. I did the Uganda one, sports administrators course.
Oh, okay.
Yeah.
That's nice.
Are there any other opportunities that I can,
You know,
I don't know.
everything is facilitated through the federation.
Okay, okay.
So I don't know. Are you in contact with the Secretary General, Mr. Kisoi?
Yes, I am very much.
Yes, I think he receives all the invites, all the upcoming programs. So
All
maybe
right.
you get in touch with him and ask him if there's anything that is upcoming that would be of any help to you.
All right, I will.
Yeah. That is Dr.
You know,
Kyle. Lois,
yeah, I
you
just
asked?
wanted to mention also, if you go to the Athlete 365, you can get you know, the toolkit, but there's also some other information related to mental health, and there's some little courses you can complete that, might be helpful. So, that's just some things that I might mention right now that you could do.
So if there's no any more questions or clarifications from to Dr. Kyle, then I think we can bring this session to one end. And before that, let me just again take this opportunity to thank those who have made time for this. I know time is not much on our side in terms of commitments, work, and other things, but making time, we appreciate that, and we can only learn when we share. Yeah, and we have to commit, as we will try and make as many, such sessions as possible so that we can, get to know more that we do not know. Unless we share, unless we have such forums, we may not really get there, because we all understand where we are in terms of coaching education. So if you even have people whom you think can share with us whatever knowledge or skills that they have, please share their numbers. We'll get in touch. Otherwise, thank you guys and have a good evening. And thank Dr. Kyle for being available and taking his time to present to us this afternoon. Thank you much.
Thank you.
Thanks.
Thank you, Doc. Bye-bye.
Thanks. Take care, everybody. Have a good weekend.
Same to you. Enjoy.
Do.